The signs of receding gums, you can reverse it in a way if you had to do surgery. So the only reason gums recede is either for brushing too hard, if we are clenching, if we are grinding, all right? Any kind of, like, the weakest spot of that tooth is where the gum and the tooth meet. So right there where that root is and that gum is, anytime we put any pressure on it and anytime we brush it, it will kind of just peel off of the tooth and it will start showing your roots. If you are stable, so every time you come in, we'll just kind of keep a note of it. This is why we do like your iTero scan with you every year, just because it does capture like where your gums were and then where they are, the day that you get scanned, and we're able to do a comparison. So if we see that things are getting worse, then we'll just keep monitoring it, giving you options, advice of how to take care of it from getting worse. If you're pretty stable, so say if like your gums haven't receded from the last time we saw you, then we can refer you to the periodontist and they could do something called a gum graft. A gum graft is basically getting gum from like the roof of your mouth and then placing it to the spots that have receded. That surgery is pretty successful as long as you're not reverting back to the bad habits that caused that gum recession in the first place. So as long as you're not brushing hard in that area, as long as you've taken care of like the clenching, grinding, anything like that, then that gum will be pretty stable of where it is. Unfortunately, there are not surgical or non-surgical ways to treat gum recession. Just because once the gum's gone, it's gone. It's pretty much keeping it from getting worse at that point. So really be careful, like whenever you're brushing, yes, please brush your gums, but don't overdo it. Same thing with like the clenching and grinding. That does affect of how, your gums are. Even if you have perio disease, so say if you are prone to doing deep cleanings every now and then, if you're able to keep your gums clean, you're able to keep like things from getting in between your gums in terms of like calculus and things like that. If you're able to just do your good job brushing, flossing all the time, then those gums will stay where they are. But in terms of bringing them back to where they used to be without any kind of surgical procedures, unfortunately not. So it's really dependent on you, making sure that home care is good, making sure you're doing your part in terms of keeping those gums clean. Just because at the end of the day, our gums follow where our bone is. So if we start getting a lot of bone loss in some teeth, you'll notice like the gum kind of following it. So try to keep your bone level up, by doing your part of keeping the calculus away from your teeth by brushing and flossing all the time. So the consequences of not taking care of gum recession is if you ignore gum recession, if you're just getting the gums to keep receding, then your roots will show. You will get a lot of sensitivity with that. And then if your roots are showing, then you're also losing support, because once the bone levels decrease, your gum will follow and then the support will be lost as well. So it's going to be more of like a perio issue in that problem, in that sense. So if you are a perio patient, if you tend to getting those deeper cleanings, then just be aware that you need to keep up with it and make sure that, all that bacteria and everything is at bay instead of keeping the bacteria in your mouth, because the more bacteria that you keep, the more calculus it causes. The more calculus it causes, the calculus is going to eat away at your bone. If the bone gets, if it keeps decreasing, then the gum keeps receding. If the gum keeps receding, the tooth starts becoming loose, and then you'll end up losing teeth. So let's try to, start with the first step and just keeping everything clean. And that way you could keep the gum, you could keep the bone, you could keep the teeth.